Okay, we have our MSU Aging Research, the GEMS panel today. And our first speaker is Zeenat Kotval-K, who sits on our leadership council. We're so pleased to have her here today. She's program director, master of urban and regional planning, program and associate professor in urban and regional planning, MSU School of Planning, Design, and Construction. And you all are well represented here today. Zeenat?
Today, we have our Research GEMS panel that's talking about housing. But what I'd like to do is to lay a little bit of context to housing. It's not only the structure that matters, it's also where that structure is located that matters. Okay. So today I'd like to talk about where you live and how it affects your health. In health research, we talk about social determinants of health, right? And that basically says where you live, work, and play affects your health, right? So where you live is where your house is located, right? So the housing location, the location of where your house is a critical player in social determinants of health. Location of housing also dictates how dependent you are on transportation, right? Everybody has to get to necessary destinations, right? Those necessary destinations can be healthcare, work, for groceries, or recreation, right? We have to get to certain places from where we live. And if we cannot get to certain places, it's going to affect our health. So in order to lay this context, we know older adults would like to age in place. We know that. You'd like to live in the house that you've lived in, you've grown up in for the longest time. You'd like to continue living in that place. It's familiar. Bless you. Older adults are volunteers. They're very active. They're volunteers, they're caregivers, they're productive members of society, amongst many other things. They see the need to be more active. Okay. They value social capital and that social engagement way more than younger generations do. In a way, they're CEOs of life. Granted, you're not given CEO money. That's the only difference. But they have the experience. They have the knowledge, that expertise of lived experiences, the leadership, philanthropy. I told you they're volunteers, right, in their community. So they have done it all, right? And their health matters. Everyone's health matters. So as I lay this context of what older adults would really like, it's based off of a broader study. It's a study of individuals, adults in Detroit and Dallas, Texas, in Detroit, Michigan and Dallas, Texas. We did a community assessment of over 800 individuals. From that, I'm going to talk about a subset of 150 older adults. When I say older adults, they're those over 65 years old. So what did some of the survey results tell us about this baseline community assessment? Mind you that this broader study is actually a 10-year study on access to healthcare, especially for those with chronic conditions. Okay, we're in year 2, which is why we're doing the community assessment, this baseline study. So some of the things that we learned from this survey: older adults have lived in their home for a long time. The average number of years they've lived in their home is over 22 years. So they're longtime residents of their community. There's an average of 3.3 people in their households. So if we think that older adults are, just them and their spouses at home or living alone at home, many times they're with families. And that points to me saying earlier that they're caregivers in many ways, right? 20% of older adults lived alone. So just 1 in 5 actually lived alone. 45% had kids under the age of 18 living at home, pointing to the fact that they're also caregivers. 53% had another older adult living with them, which also points to the fact that you're a caregiver. 82% were retired. Most of them had health insurance. 91% had medical health insurance. And 56% also have a chronic condition. We asked about the chronic conditions because that's what our overall project is about. Having transportation or having access to your healthcare appointments. Okay. Now thinking about that, being able to move around piece, right? 89% had a license, a current license, yet 16% did not drive. Okay. 31% did not have access to a vehicle in their home. So 1/3 of older adults do not have access to a vehicle. Right? 70% have had transportation issues in the past 3 months. And from that, you can see 37% said they could not see family and friends because of transportation or the lack of transportation. Over 1/3 of them could not see their family and friends. 33%, 1/3 of them, missed picking up a prescription because they didn't have transportation. Over 1/4 said that they could not go grocery shopping. 24% missed a primary healthcare appointment going to their doctor's place, right? And 15% said that they couldn't attend a faith-based or religious service. All of these destinations are important. And if 1/3 of them cannot get to the destination, that's a lot of people that need the transportation from where they live to where they want to go. So if you don't have your own transportation, if you don't have your own vehicle, you're relying on public transit. 40% did not use public transit. And the top reason for not using public transit is that they just don't feel safe on public transit. Okay. 10% of those that do use public transit also said that they don't feel safe on public transit, on those buses. 1/3 drive themselves to their doctor's appointments. 19%, 1 in 5, get driven by family and friends. 39% found difficulty finding a ride to a healthcare appointment in just the past 3 months. Right? Almost half get home care visits from healthcare professionals because of this issue with transportation. And since COVID, these home healthcare visits have started increasing. Telehealth appointments have started increasing. But before that, that wasn't available either. So one of the things I look at in any of the studies that I do is a transportation security index. Index was actually created by our friends at the University of Michigan. But this index tells you how transportation secure or insecure you might be. Okay, so the transportation security index for older adults showed us that 38% were transportation secure. They had safe and reliable transportation, right? But 36% had somewhat insecurity, and 26%, over 1/4, so 1 in 4, were transportation insecure. They did not have reliable transportation to go anywhere. Of the 6 questions that we ask about, this transportation security index, you can see that all of my percentages at about 2/3. So 2/3 of them, 60%, said they had to reschedule an appointment because of a problem with transportation. 2/3 said they did not go somewhere because they didn't have transportation. 2/3 said they were not able to leave the house when they needed to because they didn't have transportation. 2/3 said they felt disappointed because they didn't have the transportation they needed. 64%, the 2/3, worried about asking friends and family for a ride. You don't want to keep doing that. And 58% said they had problems with transportation and it affected their relationships with others. So not having that ability to get around in your community affects your health. talking about telehealth and those home healthcare visits, 59% have used telehealth at least once, but also they have said that they would really like to have those in-person appointments. They like to go to the doctor, don't want to see them over a screen. If they come home, that's a great thing, but their doctor doesn't usually come home. It's somebody else that comes home, right? So they like to maintain that contact, that conversation with their doctor. 35%, a third of these folks had gone to the ER in the past year, and over half of these folks that have gone to the emergency room or emergency department have done that because of transportation. What that means is they can get an ambulance to take them to the hospital. They did not have reliable transportation to go to their healthcare appointments to take care of their health. So that preventive healthcare piece goes down, right? Thinking about your environment, 81% have access to open space near their home, but 31%, a third, rarely go to a park. And we asked, what would you go to if you had something closer to your home? Where would you want to go? Most of them said blue or green spaces. So anywhere outside, a park, near a lake, sit and read a book, sit and meditate, right? They wanted to go out. 11% said they'd want to do something that means that they are increasing their physical activity. Relaxation of mind and body. There was a lot of meditation. There was a lot of yoga that they'd like to go there if it was closer to them. Health-related place. They'd like to go to their doctor's appointments, a community center, a nutrition consulting center, those kinds of things. Recreational. They wanted to go see their kids and their grandkids if they were living closer to them. And any OA is older adult. Sorry, I tried to fix it or fit it within that space. But any older adult focused or service or retail store. A spa. That was mentioned a few times. So 69% of older adults said that they feel good about their physical health. 85% have said that they feel good about their mental health. They feel connected to their community. 69% have said that. 80% have said that they feel safe within their community. 68% have said that they thought their community was walkable. So this effort to get them out of their house and into their community. The positive feelings are there. They definitely need to be higher, right? So the takeaway from this, housing location, where you live, has ripple effects on various outcomes, okay? And this is especially true for older adults. Health is a critical component of having a good quality of life, right? To lead that healthy life, we need good nutrition, physical activity, mental restoration, social capital. We need to be able to move around to do all of that. And to manage that, we need access to other things plus healthcare appointments. So again, where you live, where you start from, affects how you're going to travel to all of these places that are going to be better for your health. Okay, I think that is my presentation. Thank you very much.